Hello everyone. Thank you for taking the time out of your day to go over your benefits that are taking effect as of January 1st, 2018 with Round 1 Entertainment. My name is Stephanie Flores-Baru and I'm with Seven Corners Insurance Solutions, your insurance broker's office. We work closely with Round 1 Entertainment to help bring you a competitive and rich benefit package, which I'd like to present to you in more detail in this presentation. The table of contents on page 2 will briefly notate the items that I will be reviewing in this presentation. The disclaimer on page 3 notes that this guide is for illustrative purposes only. If you require more detailed information, you'll want to refer directly to your summary plan description, also known as your SPD, or insurance certificate of coverage. Eligibility and enrollment. Let's review who is eligible to enroll in the benefits described in this guide. If you're a Round 1 Entertainment full-time employee working 30 or more hours per week and have satisfied your probationary waiting period, you are eligible to enroll in the benefits described in this guide. In addition, dependent children can also be covered up to age 26, regardless of marital or full-time student status. And lastly, part-time employees can also enroll once your average working hours are over 30 hours per week or 130 hours per month after a 12-month measurement period. When to enroll. As a new hire, you're eligible to enroll following your probationary waiting period of first of the month following 60 days from date of hire. If you don't enroll within 30 days of your eligibility date, you won't be able to do so without experiencing a qualifying event until the January 1st, 2019 open enrollment period. How to enroll. Please complete the enrollment forms distributed by your HR department and submit them to your HR department for processing. How to make changes. Unless you have a qualified change in status, you can't make any changes to the benefits you elect until next year's open enrollment period. Qualified changes in status would include marriage, divorce, legal separation, domestic partnership, birth or adoption of a child, etc. If you do experience a qualifying event, you must notify your HR department within 30 days of the qualifying event date. What's new for the January 1st, 2018 through December 31st, 2018 plan year? As you can see on page 5, Round 1 Entertainment has decided not to make any changes to the plans or carriers that are available to you. Your medical plan is still available through Nippon Life Benefits, whereas your dental, group life and AD&D, and voluntary vision plan are still available through Principal Financial Group. Let's start by reviewing the medical plans that are available to you. As I mentioned, Nippon Life Benefits is still your medical carrier. No changes have been made in that regard. Now there's something important I want to point out here, and that's that although Nippon Life Benefits is your medical carrier, the network of providers that they use is called the Aetna Signature Administrators PPO network. So the reason that's important is because Nippon Life Benefits is actually responsible for verifying your benefits and processing claims. So if you go in for a service and your provider is confused and they think that Aetna is actually your carrier, they might accidentally submit your claim to Aetna for processing instead of Nippon Life Benefits. So you'll want to make sure to let your medical provider know that Nippon Life Benefits is your carrier and Aetna is only the network that they use. And all of this information is reflected on your member ID card, but it is a nice thing to be able to point out to your medical provider anytime you go in for services so that you don't potentially run into any billing issues down the road. So as you can see here, you have two medical PPO plan options that are available to you. You have a high plan and you have a low plan. Now the snapshot here shows both in-network and out-of-network benefits, but I'm going to focus on the in-network benefits today. So we'll start with the high plan. As you can see, there's a $500 individual deductible and a $1,000 family deductible, and that's on a calendar year basis. Next line is the out-of-pocket maximum. So you have an individual maximum of $2,000 and a family maximum of $4,000. And again, this is on a calendar year basis, and what this means is that's the most that either you or your enrolled family members will have to pay in a calendar year for services before Nippon Life Benefits pays at 100%. Next line is your physician office visit copay. So you're looking at a $20 copayment for a primary care doctor visit or a $50 copayment for a specialist visit. For hospitalization and outpatient surgery benefits, you're looking at 10% coinsurance after your deductible has been satisfied. You have a $150 copayment if you go into the emergency room, and you have a $50 copayment if you go into an urgent care center. For any sort of preventative services, so we're talking your annual exams or your annual well-woman exams, you're not paying anything for these services. These items are covered in full at 100% by the carrier, assuming that you're going in network. And lastly here, we have the prescription drug benefits. So for a 30-day supply that you pick up in a pharmacy, you're looking at a $15 copayment for generics, $30 copayment for brands, and $50 copayment for non-formulary brand names. And the last column here, the last row here, is for your mail order services. So if you have any medications that you take continuously and you'd like to get a 90-day supply mailed to your home, then you can just pay what ends up being double the copayment for the retail copayment. So it's double the copayment that you see above for the 30-day supply. So your mail order copayment would actually be $30 for a 90-day supply for generics, $60 for a 90-day supply for brand names, and $100 for a 90-day supply for non-formulary brand names. So it actually ends up being a better deal if you know that you need to take these medications continuously and do need the 90-day supply. So the next one is actually the low plan, and you can see here that the benefits are a bit higher. So you're looking at a deductible that's higher than it would be on the high plan. The deductible on the low plan is $2,000 for an individual and $4,000 for a family. The out-of-pocket max is $4,000 for an individual and $8,000 for a family. Your physician visit will be $20 for your primary care doctor or $50 for your specialist. So as you can see, that's the same as it would be on the high plan. And the same benefit for hospitalization and outpatient surgery would also apply here. So 10% coinsurance after your deductible is satisfied. The emergency room copay would also be the same as it would be on the high plan. So you're looking at $150, $50 copayment on the urgent care visit. Also no charges here for any sort of preventative services. And the prescription drug copayments are also the same as they would be on the high plan. So you're looking at $15 for generics, $30 for brand, $50 for non-formulary brand for retail for the 30-day supply, and double that for the mail order supply. Now again, this is only a brief snapshot of the medical benefits that are available to you. If you want the full description of the benefits, you'll want to refer to the carrier's benefit summary. And again, you'll want to choose either the high plan or the low plan. You choose only one of these for your enrollment for the January 1st plan year. Now, what is a PPO plan, you might be asking? So PPO stands for Preferred Provider Organization, and it's a type of plan that contracts with different medical providers, hospitals, laboratories to create a network of participating providers. And again, your network, your specific network for your Nippon Life Benefits Plan is going to be the Aetna Signature Administrators PPO network. And with a PPO plan, the reason why some people prefer these PPO plans over, say, an HMO plan is you actually have benefits available both at the in-network level and the out-of-network level. So while we always encourage you to utilize providers that are in-network, you do have the option to go out-of-network if you really have a provider that you like, that you want to just continue to see at the out-of-network benefit. But again, we encourage you to use in-network providers whenever you can. And the reason why we encourage you to do so is the benefits are actually much better when you're using in-network providers. And they're better because, as you can see, you have these in-network providers that actually have contracts with the insurance carriers. And those contracts only allow them to charge a certain amount for your benefits. Whereas if you go out of network, those providers don't have those contracts with the insurance carriers. So they can essentially charge whatever rate they want to for the services. So you'll also see here a medical plan example that kind of outlines how it'll save you money if you go in network as opposed to out of network. So the savings are pretty great when you go in network, and we want to recommend that you do so. What is the difference between in-network and out-of-network providers? As I mentioned previously, with a PPO plan, you have the option to go to either an in-network provider or an out-of-network provider. You have a lot of flexibility in that regard. However, there are a few differences that I want to point out here. So if you go to an in-network provider, it's incredibly convenient because they will actually submit your claim to the insurance carrier for processing, whereas if you go out of network, you'll likely have to submit the claim yourself to the insurance company. In addition, on the in-network side, I mentioned this previously, the provider is actually not allowed to charge you any more than what the carrier says they can charge for a particular service. And if they do charge more than what's called the allowed amount, the contractual rate, if they charge more than that, they're contractually obligated to write off any additional amount because they do have that in-network contract. If you go out of network, you don't have that same luxury because they don't have the contract set up with a carrier. So again, they can essentially charge whatever they'd like. So those are a few differences between going to in-network providers and out-of-network providers. As I mentioned, I can't stress enough, we do highly encourage you to use in-network providers whenever you can. So now you might be asking yourself, how can I find an in-network provider? So there's a few ways to do so. As I mentioned previously, you want to use the network of Aetna Signature Administrators Network, or ASA network. And the first way to locate an in-network provider is to contact Nippon Life Benefits directly. There's a phone number on the back of your ID card. You can give them a call and let them know whether you're looking for a specific doctor to verify network status for, or if you're kind of just looking for a directory. You can let them know what type of doctor you're looking for, where that doctor should be located, and they can either provide you with a directory themselves, or they can help you find one on the website. That brings us to the second point. So you have the option to look for an in-network provider on the Nippon Life Benefits website using the provider search feature. So there's some step-by-step instructions here on how to do so. You'll want to visit nipponlifebenefits.com, click on provider search, make sure to select the Aetna Signature Administrators or ASA network under medical, and then go ahead and just put in your criteria. The last way to verify whether a provider is in network is by calling them directly. So if you had a specific doctor in mind and you wanted to verify whether they were in network, you could just give them a call directly and ask if they're contracted with the Aetna Signature Administrators PPO network. You don't want to ask if you take PPO because in all likelihood they'll just tell you yes, even though maybe they won't be participating specifically with the Aetna network. So again, you have three options: call Nippon Life Benefits over the phone, use the Nippon Life Benefits website, or contact your provider directly. In addition, you also can come to Seven Corners Insurance Solutions and we can help you find a doctor directly. Page 10 includes information on how you can assure that your claims are processed correctly. As I mentioned previously, if you go to an in-network provider, then that provider's office will be responsible for submitting your claims to Nippon Life Benefits for processing. However, in order to submit your claims for processing, they'll need some very important information. They'll need to know your group number, which is associated with the Round 1 Entertainment medical plan that you're enrolled on. They'll want to know your original effective date, your specific member ID number, the network that you're enrolled on, which again in your case is going to be Aetna Signature Administrators Network. So your provider is going to need all this information in order to submit your claim accurately to Nippon Life Benefits for processing. Now the ID card also comes in handy if you decide to go to an out-of-network provider and need to submit the claim by yourself on your own directly to Nippon Life Benefits for processing. So when you submit a claim on the out-of-network level, you're going to have to submit a claim form, which is going to ask that you complete the group number, ID number, all of that. And again, all that information can be found on your member ID card. So in the event that you do need to submit a claim because you used an out-of-network provider, you'll want to have your ID card handy so that you can completely fill out the claim form. So page 11 is a continuance of the how to assure your claims are processed correctly section. As you can see in step 2, you'll want to verify that your claim was submitted correctly. I mentioned this previously, where you want to let your provider know that the carrier is Nippon Life Benefits. However, the network they use is Aetna Signature Administrators Network. And the reason that you want to let your provider know is so they don't accidentally submit your claim to Aetna for processing. So they can make sure to submit it for Nippon Life Benefits for processing. Step 3. Understanding LabCard. So LabCard is offered by Quest Diagnostics, and this program allows you to obtain any sort of lab work covered by your medical plan at 100% at no cost to you. So that's assuming that your labs will be sent to Quest Diagnostics. And if that's done using your LabCard benefit, those lab services will be covered at 100%. Step 4, tracking your claim. So Nippon Life Benefits has a mobile app that you can download so that you can track your claims online on your phone. And the app allows you to see in real time updated claims details such as date of service, provider network status, and where they're at with processing your claim. So this comes in handy if you just want to very quickly make sure that Nippon Life Benefits received your claim and they're actually in the process of finalizing that claim. The app makes it really easy to monitor that. And step 5, utilize member services and your broker. Seven Corners Insurance Solutions is your broker. We recommend that you contact our office if you have any questions. Obviously, you're free to contact the Nippon Life Benefits Member Services Department. They're incredibly helpful and they'll be able to answer any questions you have with your benefits. But in addition, Seven Corners, as your broker, we're here to help you with those questions as well. What is pre-authorization? So certain services must be approved by the insurance carrier, Nippon Life Benefits, before you can actually get them done. And the reason this is required for certain services is Nippon Life Benefits just wants to make sure that the services being requested by your doctor's office are medically necessary. So if you go see an in-network provider, then they're responsible for submitting the pre-authorization requests to Nippon Life Benefits directly. So they'll likely submit that along with medical documentation explaining why it's necessary. Nippon Life Benefits will then review that information and either approve or deny the request. On the other hand, if you go out of network, then you'll likely be responsible for submitting the pre-authorization requests to Nippon Life directly. So in the event that you do need to submit that yourself, you'll likely have to submit medical documentation along with that request so Nippon Life Benefits can review it. And if you need any help doing so, feel free to give us a call here at Seven Corners Insurance Solutions, and we'd be happy to help you in submitting that request. Just as a note, certain services that might require prior authorization would include hospitalization, mental health services, surgery, maternity, any sort of high-cost treatment, and substance abuse, as a few examples. Should I go to urgent care centers or emergency rooms? So many injuries and certain illnesses can be treated actually at urgent care centers. And you can save time and money by visiting urgent care centers over emergency rooms. And as you might have seen on one of the previous slides with the medical benefits outline, the emergency room benefit is going to cost you $150 per visit, whereas the urgent care center visit will only be $50 per visit. In addition, urgent care centers can treat things like minor burns, sprains, coughs, mild asthma, animal bites, broken bones, things like that. So you want to make sure that if any of those conditions apply, that you're going to an urgent care center. You want to go to an emergency room to treat more serious conditions. If you think that you're having a heart attack or any sort of chest pain, stroke, difficulty in breathing, those serious conditions are the instances in which you would want to go to an emergency room over an urgent care center. So this chart here, this side-by-side comparison, might come in handy if you're trying to decide whether you should go to an urgent care center or an emergency room. How to maximize your medical benefits. So page 14 includes some helpful tips that'll help you spend less money out of pocket when using your medical benefits. As I mentioned previously, you'll want to use in-network providers whenever possible. You want to establish a primary care physician, and the reason you actually technically don't have to do so because you're on a PPO plan, but it's much easier to schedule an appointment if you're already an established patient. If you're a new patient, you'll likely have to wait a lot more time before you can get an appointment. Use generic prescription drugs whenever possible. So if your doctor prescribes a brand name medication and you don't absolutely need to have that specific medication, you should go ahead and ask your doctor to prescribe a generic alternative if there's one available. Utilize the mail order prescription program. So if you're taking any maintenance medication, I would take advantage of the mail order program because it's a maintenance medication, you know you're going to need it, then you might as well just order the 90-day supply instead of the 30-day supply. And you'll be saving about 1 month's copay worth. Get all inpatient hospitalization and outpatient surgeries and procedures pre-authorized. So I mentioned this previously, you want to make sure to have these services pre-approved before you have them done, otherwise they might not be covered. Use urgent care instead of the emergency room in non-life threatening situations. Use the lab card offered by Quest Diagnostics. Utilize the special delivery prenatal program. Let's review the ancillary benefits that are available to you through Principal Financial Group. We'll start by reviewing the dental plan. So you have the option to enroll on either the dental POS or the dental PPO plan, depending on where you live, if you're a Round 1 Entertainment employee in California or outside of California. Under these plans, you have the freedom to receive dental care from any licensed dentist of your choice. You're going to receive the highest level of benefits if you use a provider that's either in the EPO or PPO network. The difference there, so if you're a California member, if you're a Round 1 Entertainment employee that is located in California, you'll have the option of enrolling on the dental POS plan. So under the dental Principal POS plan, you have an EPO network, you have a PPO network, and you have an out-of-network benefit available to you. You're going to be saving the most money if you use an EPO network provider. You'll save actually quite a bit as well if you use a PPO network provider, which we encourage you to use either EPO or PPO as opposed to out-of-network. For those Round 1 Entertainment employees that are located outside of California, you have the option to enroll on the Principal PPO network, the Principal PPO plan. And the difference here is you have the PPO network and the out-of-network benefit available to you. There's no EPO network here. So Principal POS for California members, you have EPO, PPO, and out-of-network benefits, or Principal PPO for non-California members, where you have the PPO and out-of-network benefits available to you. One quick note before we start reviewing the benefits in more detail is anytime you're requesting services that will exceed more than $300 for treatment, we would request that you request a pre-treatment estimate from your provider. So what will happen is they'll request a pre-treatment estimate from Principal directly. Principal is going to tell them exactly how much they'll pay for the certain services that are being requested. So you have some sort of an idea of what you're going to be responsible for paying before you have those services done. So to review this snapshot, we're looking at the EPO network, and again, that's only available if you're in California and on the POS plan. The EPO network, you're looking at a plan maximum of $2,000 per calendar year, and that plan maximum is going to be the most that Principal will pay for the benefits for the calendar year. So once you've hit that $2,000 mark, you're fully responsible for any charges exceeding that amount. You also don't have any sort of deductible on the EPO network, and that's for individual and family. For preventative services, we're talking exams, cleanings, x-rays, things like that. Those are covered at 100%. For basic services, fillings, extractions, also covered at 100%. And for major services, that's also covered at 100%. That's going to be your crowns and your dentures. Under the PPO network, your maximum is going to be $1,500 per calendar year. Also don't have a deductible on this side for either individual or family. Preventative is covered at 100%. Basic services are covered at 90%, leaving you with a 10% coinsurance responsibility. And major services are covered at 60%, leaving you with a 40% coinsurance responsibility. And lastly, the non-network or out-of-network benefit. If you use an out-of-network provider, you'll still have a calendar year maximum of $1,500. You will have a deductible on this side of $25 per individual, $75 per family. The preventative benefit is going to be 100% of UCR. And that's 100%, so that means essentially any amount above that 100% UCR, that will be your responsibility since you're using an out-of-network provider. For the basic services, it's 80% of the UCR, meaning you'll be responsible for the 20%. For major services, 50% of UCR, meaning you'll also be responsible for 50% of the benefit. And lastly, the maximum accumulation feature. So if you don't use all of your maximum, you can roll over part of it if you meet one of these three criteria. So the first is if you at least get one checkup in the calendar year. The second is if you've used less than $1,000 on the EPO or $750 on the PPO or out-of-network levels in claims. And the third is just pointing out how much your rollover amount can potentially be. And that can potentially be $500 under the EPO or $375 under the PPO or out-of-network benefits. So as you can see, these benefits are very, very rich. $2,000 for a plan maximum, that's very good. So we encourage you to keep your teeth healthy, keep your mouth healthy, and use these benefits whenever you need to. How to find a network provider. So there are two ways that you can go about finding a network provider under the Principal plan. The first way is to call them directly. There's a phone number on the back of your ID card. They can help you find a doctor either in the PPO or EPO network. They can also send you a directory. You can also go to the Principal.com website, and we have some step-by-step instructions here on how you can do so. One important thing to point out is that when you select the network, if you're located in California, you'll want to select the Principal POS plan. However, if you're not located in California, then you want to select the Principal PPO plan as the option. Actually, there's one more option. You can check with your provider, similar to the medical plan. You can just call if you have a dentist in mind, give them a call, and ask the same question. Are you contracted with Principal POS or PPO plans? Again, don't ask if they take PPO or POS plans because they'll probably just tell you yes. Ask them if they're contracted. So here are just a few more ways that you can find in-network providers. And again, if you would like Seven Corners Insurance Solutions to help you look for one, just give us a call directly. Using in-network versus out-of-network providers. So similar to the medical, you'll want to go in-network whenever you can. So under the dental plan, that's either going to be under the EPO or the PPO. Whenever you can utilize providers in either of those networks, you want to make sure to do so because the savings are going to be much greater. And this page basically has a few examples of how much you can save if you're using an EPO, a PPO, or an out-of-network provider. And you'll see in this example, you're saving the most if you're going to an EPO provider. You're saving a significant amount if you go to a PPO provider, but you're not saving much if you go out of network. So if at all possible, use the EPO network or the PPO network. Both are very good. So here's just a few examples. Take a look at them in more detail so you can see exactly how much you could save under these circumstances. And again, we encourage you to use EPO or PPO networks whenever possible. Another ancillary benefit that's available through Principal Financial Group is the life insurance and accidental death and dismemberment insurance. Accidental death and dismemberment is also known as AD&D. Round One Entertainment provides this benefit to all employees who are eligible, meaning you're working over 30 hours per week, and they're providing you with $20,000 worth of group life and AD&D insurance, and they're paying the full cost of this benefit for you. So if you were already previously eligible, you should have enrolled on this plan already. You can't make any changes. There's no true open enrollment period for this plan since you're required to enroll because Round One Entertainment pays the full cost. However, what you can do is update your beneficiary information. Now you want to go ahead and do that with your human resources team, and anytime you want to update your beneficiary information, please let them know, because in the event that you pass away, we want to make sure that Principal is paying out your claim to the correct person. The last ancillary benefit available to you through Principal Financial Group is going to be the voluntary vision plan. So this plan is completely voluntary. You're fully responsible for the cost of enrolling in this plan for yourself and any dependents. And you'll find here a snapshot of what the benefits entail. So again, the carrier is Principal, the network is going to be VSP, and the plan is called the Voluntary Managed Care Vision Plan. So you can see here in this snapshot both the in and out of network benefits. You're allowed exams, lenses, and frames, 12, 12, 24, meaning you can have an exam every 12 months, lenses every 12 months, and frames every 24 months. And you have to wait a full 12, 12, or 24 months. It's not a calendar year benefit similar to your medical or dental. It's from the date that you have the service done. You have to either wait 12 months or 24 months. There is a deductible here or a copayment, so you're looking at paying a $10 copayment for an exam or a $25 copayment for materials. So that's going to be your lenses, your frames. Vision exam, that's 100% covered if you're going in network. Again, you can have that done every 12 months. Lenses, that's going to include single, bifocal, trifocal, and lenticular. Those are also covered at 100% if you're going in network. And you can have those done, or you can obtain frames also on a 12-month basis. Frames, you're covered up to $150. That's going to be your frame allowance. Any amount exceeding that, you'll get a 20% discount off of any amount exceeding the $150, and you can get frames every 24 months. Contact lenses are also covered. It covers up to $150, and those are covered every 12 months as well. So you'll see here there's an out-of-network benefit, and they'll give you the amounts that you'll be reimbursed up to. For example, $45 you'll be reimbursed for an exam. However, just like every other benefit, we want to encourage you to use the in-network providers whenever you can because the benefits are much better. And you'll also see here the monthly rates. So these are the rates that will be deducted from your payroll on a monthly basis if you enroll yourself or any of your spouse or family members. Comparing the costs with and without vision insurance. So page 20 has a few different tables where you can see how much you would save if you have insurance as opposed to not having insurance for certain vision services. So under the first table, for example, using benefits for glasses. Without insurance, you're looking at an exam of $60, that's what you're going to pay, but with your insurance, you only have a $10 copayment. For frames, without insurance, you'll pay at least $200, but assuming that you're paying $200 with your insurance and you get a $150 allowance, out of pocket you'll only be responsible for $50. For lenses, for single vision lenses, for example, without insurance, we're looking at $80, as opposed to with insurance, you won't have to pay anything for those lenses. So total, without insurance here, for the exam, frames, and single vision lenses, you're going to pay $340 if you don't have insurance. However, with your Principal plan, you would be paying only $60. So there's a $280 savings here. And you'll see the same example using contact lenses. So you'll save about $200 with insurance for the contact lens benefit. So this is really helpful if you're kind of on the fence about whether you actually need the insurance. I would take these two tables into account when making your decision on whether you should enroll on the vision plan. Health insurance terms. So these pages are here to help you in clarifying any of the terminology that was previously used. We know that healthcare and the lingo that comes along with it can be very confusing. So the health insurance terminology section is just to help you out in understanding what some of these words mean. After reviewing this section, if you have any questions or if any of these items or terminology is still unclear to you, please feel free to give us a call here at Seven Corners Insurance Solutions, and we'd be happy to help in clarifying what these definitions mean. Pages 23 to 29 are required notices that Round 1 Entertainment must issue to all of their employees. You'll see here on page 23, there's a section about your prescription drug coverage on Medicare. When can you join a Medicare drug plan? What happens to your coverage if you decide to join a Medicare drug plan? Page 24 includes sections on when will you pay a higher premium or a penalty to join a Medicare drug plan. For more information about this notice or your current prescription drug coverage, who to contact, and for more information about your options under Medicare prescription drug coverage, who to contact. Page 25 includes information on the Women's Health and Cancer Rights Act, the Notice of Special Enrollment Rights, and permitted mid-year election changes. Page 26 includes information on premium assistance that's available to you under Medicaid and the CHIP program. Last but not least, we have a directory here for you as a Round 1 Entertainment employee to contact if you have any questions regarding the employee benefits described in this guide. We don't want you to hesitate to reach out should any questions or issues come up, which is why we provided you with this directory. So Mr. Mike Katata is the first contact. He's obviously your contact at Round 1 Entertainment, and we have his phone number and email address listed here. Nippon Life Insurance, they're your medical carrier, and they have departments available that speak both English and Japanese to help you out in case you have any questions. Website and email addresses are listed here as well. Principal Financial Group, they're your insurance carrier for the dental, group life and AD&D, and vision plans. They have different phone numbers depending on the line of coverage that you have questions on, so please take that into account. We also have their website and email address listed here as well. And lastly, your insurance broker. That's us here at Seven Corners Insurance Solutions. Your primary contact is going to be Amiko Sasahara. She is our Executive Vice President. We have her phone number and email address listed here. Myself, Stephanie Flores-Baru, I'm the secondary contact on the account, so don't hesitate to reach out. My phone number and email address are also listed here. And last but not least, Andrea Kennedy. She's one of our customer service representatives, and she can help with any sort of day-to-day inquiries and processing information, things like that. So thank you so much for attending and listening. And again, don't hesitate to reach out to us at all if you have any questions. Our goal is to make everything easier for you and to help you understand your benefits and to ensure that you don't run into any issues at all. So please don't hesitate to reach out. Again, thank you very much and hope you have a good day.